thank you to Tim and Vicky for joining us this morning and interpreting. So while vaccinations are going pretty well, it's clear that we still have COVID in our community. And I'm going to read off the numbers to emphasize the point. Hate to always be reminding, but we need to always be reminded. So positive cases in Hamilton County, as of this date, 149. The change from last week is 488. That's the increase. Hospitalizations were up to 3,091. The increase from last week is 29. Things are going pretty well. And it's clear that we still have COVID in our community. And I'm going to read off the numbers. We sit at 1,206. Hate to always be reminding, but we need to always be reminded. We're still losing folks to COVID-19. Positive cases in Hamilton County. Some folks are getting hospitalized. 149. The change from last week is 488. That's the increase. Hospitalizations were up to 3,091. The increase from last week is 20. Positive story. I think it's important to remind ourselves we're still losing folks. And the one thing that Commissioner Kesterman, who is with us today, has reminded us of is that the folks that are in the hospital, 100% of them have not been vaccinated. So COVID in our COVID-19. I'm going to read off the numbers. We sit at 1,206. Even if hate to always be reminded, which would be a very slim possibility. And 91. The increase from last to be hospitalized or it becomes fatal. So just want to reiterate something that Greg has been saying for the last couple of weeks. And so while we're still working through the vaccine hesitancy, we've been talking about this the last couple of weeks. Vaccines 100% of them plenty have not in Hamilton County. So COVID in our community, 0.6% of the population has been vaccinated. And so the numbers are creeping up. And Greg has this great chart. I hope you're showing it today. Or it becomes fatal. So just want to reiterate something that Greg has been saying. All right, we're going to have it next time I'm here. Greg, I keep asking you for the chart. So anyway, we have this great chart that Greg will have in 2 weeks that shows the ages split out 5 years apart. And remember, that's how the vaccines were rolled out. And so the folks in the older populations are really doing well. And some of them are over 80% vaccinated. It's really impressive. They've also had access to the vaccine longer than the rest of the population, so it stands to reason that they would be doing better than some of the younger groups. But the younger groups are also starting to get vaccinated and creeping up. And so it is all a positive trend. All of the lines creep up. And so then as a community, the vaccines are creeping up. So again, we're making some headway there. And we're also coming up with creative ways and creative spaces for vaccines. Greg illuminated a bunch of those last week, as did I. One that I want to highlight, I don't know how many of you are familiar with my background, but I'm a big fan of breweries. I come from the West Side. I'm Catholic. I like a good cold beer. And so we have so many breweries in this community, and we've talked about the economics of that and how they've added vitality to these communities. Well, 50 West is one of my favorites. They remained open during COVID because they had so much outside space, and they were retrofitting as we went and creating safe spaces and outside spaces for people to gather. They're also on a bike trail, which is tremendously handy for them. And they also have really good beer and food. And so they are hosting a vaccine clinic next week. And so I think it's a great example of how public health is being creative in a way to make sure that everybody has access to the vaccine or inclined to get it. Interestingly, public health and I reached out to Bobby Slattery at 50 West on the same day. And so Bobby was very excited. And so they're doing a vaccine clinic next Tuesday, that's the 18th, from 3 to 6. It's located in Columbia Township on Wooster Pike. So for those of you that have been hesitating, run out to 50 West, grab a burger, get a beer, get your shot. It's a perfect opportunity. And there hopefully will be more breweries coming online. We're working on that, actually. So the other big news right now, as you all know, is that vaccines have opened up for 12 and over. So we've got a new age category that is eligible to get the vaccine. So we are joined by Dr. Patty Manning. Very excited to have Dr. Manning on this morning. We'll get to you in one second, Dr. Manning. But that she's going to talk about what that means, what that looks like, the efficacy, making sure that that's safe for kids that are 12 and over, and talk a little bit about that process. One other thing related to vaccines, please go to testandprotectcincy.com. Sorry, testandprotectcincy.com to get information about where vaccine sites are, because they change from week to week and they're all over the place. Before we get to Dr. Manning, I am going to bring up Greg Kesterman, Hamilton County Health Commissioner, for his report.
Good morning, and thank you, Commissioner. We continue to make a lot of progress with vaccinations in our community. We are up to 357,000 Hamilton County residents having received their first vaccine, which is exciting news. Touching on the numbers first, on December 10th, we continue to have had our worst peak with COVID cases in our community. We had 716 cases. Over the last 7 days, we are down to 70 cases per day on average over the last 7 days, which is excellent news. I'm glad to see this number finally dip below 100 cases per day, which is where we've been hanging out for quite some time. We have continued to see new variants in Hamilton County. We are up to about 60 variants at this time. Of those, the majority of them are the UK variant. Once again, though, the key tools for protecting yourself against the variants, I would say the number one key tool is getting yourself vaccinated. We know the vaccine is effective, and we know that it works. So if you're concerned about the variants, please get yourself vaccinated and be part of the solution. Our reproductive number for Hamilton County follows our case number very closely. Today we are at 0.89, below 1 because our cases continue to decline over the last several weeks. For the region, we are also at 0.90, so also a positive sign. Looking at our hospitals, we've been hanging out around 140 patients within our hospital systems in the 14 county region. This morning we are at 129 patients within our hospitals, of which 40 are in the intensive care unit and 35 are on a ventilator. Once again, the best way to stay out of the hospital with regards to COVID-19 is to get yourself vaccinated. If you've been delaying, there are plenty of appointments available. So shifting over to the vaccine, we have, as mentioned, 357,000 residents have been vaccinated. That represents 44% of our total population, including children that have been vaccinated. When you take out those that are between the ages of 0 and 15, we as a community are at 52% vaccinated, so we are making excellent progress. When you look at those individuals that are over the age of 70, we are at 80% vaccinated, so we have made tons of progress at protecting our most senior residents within our community. And I truly believe this is having a huge impact on reducing hospitalizations in Hamilton County. We continue to fill vaccine appointments. We also continue to take walk-in appointments. I want to reiterate, if you've been putting off getting vaccinated because you thought it wasn't your turn, or you wanted to make sure that other folks who had underlying health conditions had the chance to go first, now is your time to get vaccinated. We have appointments available all across Hamilton County, both at the public health clinics, which are spread throughout Hamilton County. The hospital systems have appointment availability as well as walk-in availability, and several private pharmacies, including Kroger's, accepts walk-ins now at this time as well. Probably the most exciting news over the last couple days, on Monday the FDA approved Pfizer vaccine for 12 to 15-year-olds. The next step before it can be approved for them officially and we can start vaccinating is for the ACIP to approve it, and that meeting happens today, and it is highly anticipated that they will approve it, at which point in time the Centers for Disease Control Director will review and most likely approve, and then Governor DeWine for the state of Ohio. All of this could happen today, and so by as early as tomorrow, we could begin our vaccination work for those in the 12 to 15-year-old age group. Straight from the study, we know that this vaccine in the study was 100% effective at protecting those children or adolescents from COVID-19. So really exciting how effective this vaccine has been. So please, parents, start thinking about where you can get your child vaccinated. Only the Pfizer vaccine will be available, so we'd encourage you to go on testandprotectcincy.com and find a Pfizer clinic so that you can get your child vaccinated. I will end there, but appreciate everyone's work in ending this pandemic.
Thank you, as always, Greg. Now we're going to turn to Dr. Patty Manning. She's the Chief of Staff for Cincinnati Children's Hospital Medical Center. She is the expert in the field. We are so grateful that you're joining us this morning, and I'm going to turn it over to you. Welcome.
Well, great. Thanks. Thanks, everyone, and good morning. Yeah, we are very excited. We are eagerly awaiting the final approval from the CDC Special Advisory Panel, the ACIP, so that we can begin our work. As you heard already, you heard yesterday from myself and Dr. Frank, we've really had a front row seat on the work that's informed the safety and the efficacy of this vaccine, the Pfizer vaccine, in this age group. And, you know, it's the children of our friends and our colleagues that participated in this work that have helped us understand and appreciate the benefit of this vaccine to children. So I would just echo the words that you've already heard. We strongly are going to encourage families to consider getting their 12 to 15-year-olds vaccinated along with their 16 to 18-year-olds. And I greatly appreciate the questions that families have about this. I encourage families to speak to their trusted partners, their pediatricians, their primary care providers, or their specialty care providers. Every day we have children hospitalized with COVID here at Cincinnati Children's. So it's not that COVID doesn't affect children, it does. And we've had children who've been quite ill with COVID. We also have children who've been incidentally COVID positive. They're here for other reasons. They might have cancer, they might have a broken bone, they might have appendicitis, and they're then found to be COVID positive. And I promise you, you don't want to have a sick child who then also has COVID and have to worry about the interaction of having COVID on top of another childhood illness. So we stand ready. We've got clinics set up both today, and probably we won't be able to take 12-year-olds just yet until we have that approval, but tomorrow, we've got them on Thursday, we've got them on Saturday. We'll be taking walk-ins. Many of my partners and colleagues in primary care are ready to do vaccinations as well. So we're ready.
Yeah, thank you. And I'm delighted that some people are so excited. I know Greg would say the same, that there were some people showing up at clinics with their kids already, and we're not quite there, but we're so close. So anyway, thank you for reiterating that enthusiasm. So Bridget, with that, we're going to go to questions.
Great. Ann Saker with the Inquirer has questions for all the speakers.
Oh, well, I'll stay put for a moment. Good morning.
Come on. Thank you very much. Appreciate the time this morning. Commissioner Driehaus, I am the last person on earth to say anything bad about beer or breweries, especially the ones here in Cincinnati, but is it kind of a mixed message to be setting up vaccination clinics at places that dispense alcohol?
Not in my mind, it's not. You know, we're trying to capture, especially the younger set who frequents places. Where do they go? They go to breweries. And so we're trying to make the vaccine as accessible as possible to all age groups. And so what better place than a brewery to have the vaccine available? So in fact, I think Holy Grail had a vaccine clinic yesterday set up on the bank. So no, I think it's a fantastic idea. I mean, the idea is to have widespread vaccination so that we can get to herd immunity. And I can think of no better place than a brewery.
Thank you.
I'll step aside for Greg.
Thank you very much. Greg, I wonder if it's possible yet to talk about the potential seasonality of COVID. The numbers are going down pretty steadily across the board, and I'm not trying to be a Cassandra, but what's the winter going to be like?
You know, we always have the concern that we will see COVID take on that seasonality. But I think what's different with this pandemic than any of the other pandemics that scientists have looked at over the last decade, or century, I should say, is that this pandemic, we have a vaccine that is extremely effective at fighting COVID-19. And so if we continue to get our population vaccinated, I think we should be in a good spot come this winter and fall.
We've seen, and one more thing, Greg, we've seen this, we watched Michigan to see how they're comparing with us. Do you think we're ahead of the game where Michigan is concerned? Are we, is the trend going to continue downward? Because Michigan's been bouncing up and down quite substantially the last few weeks.
You know, we have had such great success at vaccinating individuals over the age of 60 in Ohio and Hamilton County. And we know that those individuals are most susceptible to serious illness with COVID 19. I am extremely optimistic that the progress that we as a community have made with those vaccinations will have great results, and we will not see what we're seeing in Michigan.
Okay. And then finally for Dr. Manning, it's good to see you. Thank you very much, Dr. Manning. So as you no doubt know, for quite some time, the last 10 years or so, we've had this growing vaccine hesitancy movement across the spectrum. And I wonder what you are seeing so far, whether that is getting complicated with the hesitancy we're seeing with the COVID vaccine, or is it all coming into one expression? I mean, I just wonder about how parents who don't like giving their kids any more shots than they have to. Let me ask you this. How many kids have been can you tell us how many kids have been at Children's Hospital with COVID?
I can't give you an exact number, but it's been in the hundreds. Hundreds of children have been hospitalized with COVID. And I can tell you that every week we track the number of positive COVID tests in children that come through our labs, and it's over 100 every week. So while the weekly cases, for the county were at 488, I can tell you that over 100 were children that were tested, and probably more. So children get COVID. To your question about vaccine hesitancy, I think anytime there's an excuse to kind of pile onto that argument, it's leveraged by people who are vaccine hesitant. I have dealt with vaccine hesitancy for my entire career. I'm a developmental pediatrician. I see children with autism spectrum disorder. I feel like I was at the forefront of the vaccine hesitancy movement around that diagnosis. And we all know that vaccines do not play any role in causing autism. It can never be said enough. With COVID, the vaccine concerns have come from an equally ridiculous argument for which there's no medical or scientific basis around COVID vaccine and fertility concerns. I heard one yesterday myself from a colleague in clinic about concern about sperm count in COVID vaccine, and I said there is zero basis. What often happens with vaccine hesitancy is a tiny shred of a scientific argument is made and a connection is made that it has no basis, and then it turns into a concern. And I truly feel for families who have to navigate this. They have to navigate the arguments and the false information that's thrown out there on the internet, and they feel like they can't win, like they can't make a right decision. I want to protect my child from COVID, but I've been told that I have to be afraid of that vaccine. So it's really our responsibility as healthcare providers, as people in the media whose voice can be amplified, to share correct information and let people know that this is safe and this is the way to protect your children, to have them get vaccinated.
Right. No indications. I know it may be too soon to say, but there's no indication that this causes birth defects because there have been people using the word thalidomide in connection with this in the same sentence. So what do you think of that?
I think that's offensive at every level to equate something as helpful and as important as a vaccine to thalidomide, which is decades old now of an experience that, and it was an unfortunate one, but there is zero connection or relationship. But again, it's convenient. People just want to draw connections and say, well, look, that happened, so therefore this might happen. And it's really sad.
Thank you very much.
Sure.
Thank you. Next up, we have Josh Bazam with WCPO. He has questions for either Denise or Greg.
Hi, thank you for your time this morning. My question, the CDC just put out recommendations related to cruise ships that they could operate if I think 95% of passengers could prove they were vaccinated. Do we think at a local level it would be a good idea to have, they're calling it the vaccine passport for certain activities? Or would you say, should businesses consider checking a customer's vaccine status for particular activities for safety reasons?
So I think we have a lot to learn, but I think what we know from the Centers for Disease Control is the vaccine is effective at reducing illness associated with COVID-19. I have heard of some employers highly incentivizing their workforce getting vaccinated. If a employee or several employees causes an outbreak in a workplace and several employees have to take off work, that can cause for a shutdown of a production line or a closure of the business. So incentivizing vaccines is an extremely important tool for helping to increase the vaccination rates. At this time, I have not heard any policies coming out of the state of Ohio related to vaccination cards or proof of vaccination prior to participating in certain events. But at this time, I would say it's certainly an option that businesses could consider.
Sure. And I know, I think there is some talk among Republicans in Columbus to possibly ban a public passport, a state mandated passport, but I don't know if it would extend to private companies. Would that, if that were to go through in the future, would that have an impact on us locally, or what kind of impact would that have?
Yeah, I'm not familiar with any potential legislation at this time, so without reviewing it, I wouldn't be able to comment.
Sure. Thank you.
Absolutely. Anything to add?
I'm going to add one quick thing, and we talked about this yesterday at our commission meeting. You know, I think as policymakers here at the county, we do want to try to lead by example. And so we are contemplating a program as we have our workforce come back, which June 1st is the date where we're going to have most of our folks come back. We want to make sure, well, first of all, we're doing a poll to see how many of them are vaccinated to get a baseline. But then also, we're going to try to think of a way to maybe incentivize those that haven't gotten the vaccine to get the vaccine. So we've got something called Wellness Bucks. They're related to our healthcare here at the county, and so people get wellness bucks for doing things that are healthy behaviors. Getting a vaccine is one of those things, and so we're likely to incentivize that behavior by giving wellness bucks and giving them to folks that already got vaccinated as well. So it's just an example of how I think we are thinking through, I think we're all thinking through how we can make sure that we have as many people vaccinated as possible before we start to have people go back to work and interact with more people than we've been interacting through the pandemic.
Thank you. Next up, we have Brian Hamrick with WLWT News 5.
Hi, Brian.
Brian, you're muted.
Oh, well, there you go.
Okay, I'm sorry. I was I got a new phone. That's awesome. So here we go. I'm just looking at the overall here, trying to get how we plan to reach kids at this point. We've been working with adults. We've had mass vaccination centers. Those kind of things have worked pretty well for adults. It seems like we probably need another approach to get to kids and get to parents, because what I'm hearing is parents are like, well, in fact, I've interviewed people who said, you know, I'm in healthcare, I got the vaccine, but when it comes to my kids, I've really got to think about this. So what are we doing to reach those folks? And kind of what's the overall plan from education, getting into the schools, to pediatricians' offices, to expanding the education about vaccines?
So to start, I'd like to reiterate that we are not requiring children to get the vaccine. This is an individual choice. But what we are trying to do is make sure that individuals understand the safety of the vaccine and the effectiveness of the vaccine. We want to make getting the vaccine easy, and so my office and many partners in Hamilton County are providing vaccine clinics in schools. We're providing clinics on the weekends, after hours, and really just trying to bring the vaccine to where people are. And so if we find a need for 12 to 15-year-olds is different. Obviously, we're not going to reach 12 to 15-year-olds at the brewery, so we're going to have to use different strategies to reach those folks, and we're going to continue to shift our strategy to make sure that we are meeting them where they are. The state of Ohio is also working with many hospital systems and clinical systems to make sure that they are providing vaccine to primary care physician offices as well as pediatricians, because they are clearly one of the most trusted medical providers for any family. And so if a parent wants to get the vaccine, I would encourage them to talk to their doctor and to make an educated choice. As we just heard, we know children are susceptible to COVID-19. Their illness on a whole might not be as bad as an 80-year-old, but they still can get sick and have long-term consequences.
Dr. Manning, could you talk to us a little bit about, I know you see a lot of folks firsthand there. Can you talk to us a little bit about what the efforts and maybe what the efforts should be going forward? Because this won't be the first. We're going to have, 5 to 11 pretty soon.
Absolutely. No, I'll just add to what Commissioner Kesterman shared, and that is that, we have the benefit now of having been doing vaccinations now for a number of months. And we've got better supply, we've got better operational systems. And so it feels very different for me from the beginning of vaccination opportunities where people were scrambling and they couldn't make appointments. Now our systems are pretty well oiled. We've got walk-in opportunities, we'll have walk-in opportunities. So it feels easier in terms of those types of operational barriers. But your point about, parents feeling like, well, I'll do it for myself, but I won't do it for my kid. It kind of swings both ways. This is what I love about pediatrics. People often take better care of their kids than they do themselves. And so for some parents, that means I'm going to run and get them vaccinated right away. We may have that experience where people who are hesitant about getting their kids vaccinated get to see lots of other people who do get their kids vaccinated, and they get to see that it's gone well, that it's been okay, that there's been no risk, and then they come on board more gradually. But we still have to make it easier for them. So to the points that were already made, we're going to be in schools. We've got many more primary care offices, especially pediatrician offices. Excuse me while my light goes out here. Sorry about that. We've got pediatrician offices getting vaccine, ordering on demand. That's been made much easier at the state level. So it's going to be integrated into primary care settings much more quickly for children than it was for adults. And so I think there have been many barriers that have been removed at this level, at this stage in the game, than there were back at the beginning of our vaccination efforts.
How important are getting all of these kids vaccinated? How important is that to the overall herd immunity efforts?
It's critical. It's critical. We cannot achieve herd immunity, or what some people refer to as community immunity or societal immunity, if we don't include kids. I do think that we'll have data to show people that demonstrates we already do, that the burden of disease right now is much more heavily tilted in the direction of young children, young adults. Hospitalizations are higher in young adults. As the population of people being vaccinated is older, the unvaccinated population is the kids. They're going to be the repository for this disease. And with more kids getting COVID, because we're not going to get completely rid of it until we have higher rates, more kids getting COVID means more kids getting severe COVID. And so it is critical that kids are included in this work to get towards community immunity. We can't achieve it without them.
And talking to the person that you trust to get your other health information, how key is that going to be? I don't think people are, if we say it, or Dr. Kesterman, or even you, if they don't know us, they're not going to be as likely to believe us, I don't think, as they would their own pediatrician. How key will that be in making people kind of understand the facts and sorting this out?
So I had that experience yesterday in clinic, seeing a patient of mine who, and I see patients who have autism spectrum disorder, and they asked me point blank, how do you feel about my child getting this vaccine? And that was the kind of conversation that needed to happen. You're right, not from a news presentation or an unknown person, but somebody who's known that individual, as I have for years, and known their unique issues. The same goes for pediatricians. When somebody's taken care of your baby since they were a newborn and given them other vaccines and counseled you, that's the person who you trust to guide you correctly. That's the person who you hopefully feel comfortable with expressing your concerns and your fears, just like the families that I see when they can say, hey, I'm nervous. One of our first vaccine clinics for adults with disabilities, I got to see a family who I'd known for a long time, and they were anxious about having their child vaccinated because they recall all the concerns about other vaccines. But being able to see a trusted face and a partner made the difference. And so that's a great opportunity we have for our primary care pediatricians.
I think that's all I have for now. Thank you.
Okay, any last questions from reporters? And it appears that we do not have any more questions.
All right, well, thank you. Thank you, Dr. Manning, so much for being here. I just want to remind people that even if you're not quite ready to have your child vaccinated, that conversation is important as a precursor, perhaps. And so medical professionals, and I've heard this now from Dr. Manning and many others, saying they're open to the questions. Call your doctors. Call your doctors. Make sure you know what you're doing as you think through, getting the vaccine for yourself or your child. It's so important, and they want to be asked those questions. I heard that from public health when I visited a clinic the other day. The nurses are like, please come in and ask the questions. So anyways, I hope this was helpful. Thanks again to Greg Kesterman, as always, for being here, and Dr. Manning as well. We'll see you next week. Thank you.